Hi, my name is Simone Carton and I'm one of the clinical neuropsychologists working at the National Rehabilitation Hospital in Dublin. I'm going to talk to you about mood, behaviour and personality following acquired brain injury or illness. These are three quite discrete words, mood, behaviour and personality, but they're highly interconnected. And in order to ensure reasonable psychological well-being, these three domains need to be reasonably well balanced. They're the very things that make us tick and what make us uniquely different. Following illness or injury to the brain, the accompanying changes can affect the job of the brain, which is essentially to manage and modulate our behaviour, mood and personality. So following brain injury, people can experience a range of difficulties within behaviour, mood and personality. Within behaviour, they can become more irritable, unfocused, distracted, withdrawn. Their behaviour may be inappropriate and are disinhibited. And quite commonly these problems are associated more so with changes to the frontal lobes of the brain. In mood, anxiety and depression may become more evident. They can be the adjustment to a life-changing event or post-traumatic stress disorder, as well as a heightened vigilance and pervasive feeling of anxiety and tension. The personality changes, quite often put under the label of organic personality disorder, can include fixed delusional beliefs, psychosis, morbid jealousy, and mood disturbance that's really very marked and very troubled for the person. All these problems are interplaying, of course, with the cognitive changes that are quite often accompany brain injury. Difficulties with concentration, with working memory, short-term memory, planning and organising, but very centrally insight and awareness, the ability to reason and make good judgment. When they're compromised, it really can be very detrimental to the personality and behaviour of the person. So what we're trying to do in understanding this person's psychological story is to know the nature of the brain change and the neuropsychological sequelae. Be aware of the person's pre-morbid history. What was their personality style? And what are the concomitant factors like pain or physical disability or drug abuse that may be contributing as well to these changes? And what can we do to help and to consider with this patient group is to have a good psychoeducation, to understand the behaviour, to understand the pathology, and to impart that to the patient. When we know what triggers and enhances or detracts from the behaviour, that's helpful. Positive behaviour support is a central therapeutic arm in managing these situations. And priming, taking time to consider the psychological story is critically important. Together, these behaviours will help our behaviour in attending to this particular patient group who are experiencing these problems.